Hi there, I'm Amy Fenning, Maryville University nurse practitioner student, and I'm here today to perform my abdominal assessment. My patient today is Ryan. Ryan is in a supine position so that I can assess his abdomen. He has emptied his bladder. I've washed my hands. How you doing today, Ryan? Feeling okay? Good. So the way we'll start with the abdominal assessment is, first and foremost, I just want to start with inspection. I want to look at his abdomen, check it for uniformity of skin color, see if I see any scaphoid dips, any deviations in tone. I don't see any masses or protrusions. I'll get down on the side and take a look from the side. I can definitely see his aorta pulsating, and I will begin with next auscultation. The reason I will do auscultation first is not to disturb bowel sounds, and I will start in the right lower quadrant and move in a clockwise pattern. Right lower quadrant being at the point of the ileocecal valve, and that's where I will hear bowel sounds the loudest. Normal bowel sounds are active between 5 and 30 times a minute. If I don't hear anything, I will listen up to 5 minutes. You definitely have active bowel sounds, Ryan. I'll move up to the right upper quad, right left upper quad, and left lower quad. Then I will use the bell of my stethoscope to listen for bruits at the site of the aorta. And the iliac arteries. And the femoral arteries. And I do not hear any kind of bruit. Ryan's got a normal male pattern of hair distribution on his abdomen, and now I will start with percussion. Basically what I want to do generally in an abdominal percussion, it's tympanic. There's tympany because it's an air-filled system. We will hear dullness where the liver, and hopefully we won't hear any dullness where the spleen is, because we shouldn't be able to assess the spleen. So I'm just going to start again, right lower quad, and that's a very tympanic sound. I will start mid-clavicular line and move down until I hear dullness of the liver. Right there. And I will mark it with my pen, and then I will start at the area of the umbilicus and move up, and I can feel the change as I percuss. General rule of thumb, it should be under 7 centimeters, and it is about 5.5 for the liver span. And then I will palpate the liver to see if I can feel the edge. I'm going to use a hooking maneuver. Ryan, can you take a big deep breath in? I'll get right up to the area of his ribs and then let out. And I should be able to feel the tip of his liver as he exhales. Do it again, one more time, buddy. And there it is, right there. I can do that same maneuver here on the, you can let it out, on the left side. However, in a normal healthy spleen, I should not feel any part of the spleen. If I did, that would be sign for concern. But I will assess here, and when I percuss for the spleen, I'm going to do it at the mid-axillary line because the spleen is over to this area. And I don't hear any change there. Big deep breath, and I'm going to palpate there. Anything hurt you? No. I'm going to start with light palpation now that I've percussed, okay? So I'm just going to touch your belly. You tell me if anything hurts. You good? Okay, good. And what I'll do now is a deeper palpation. Feel for any masses. Anything? Okay. I don't feel any masses. Everything feels okay. I don't feel a distended bladder. If Ryan was coming to me with complaints of abdominal pain and I wanted to assess to see if he had perhaps a gallbladder issue or an appendix issue, what I would do is do a little bit of a different maneuver up towards his, his right upper quadrant is where his liver and his gallbladder live. If his gallbladder was inflamed, and I asked him to take a deep inspiration and I palpated at the same time deeply, if he had an inflamed gallbladder, he would not be able to continue that maneuver because of pain. Go ahead, Ryan. Deep breath. Does that hurt you at all? No. Okay. Then there's a couple different maneuvers we can do to test to see if the appendix is inflamed, one of which is just a rebound test. Rebound meaning if I press deeply in his left lower quadrant and release, the pain should radiate to the right lower quadrant where the inflammation of the appendix is. I will try that now for you, Ryan. Does that hurt when I let go? Okay. Another test I can do is to bring up his leg, bend your knee, and then push your knee towards your face. If that elicits quite a bit of pain in his right lower quadrant, that's another sign that he has an inflamed appendix. Okay, Ryan? And I think that about sums it up for your abdominal video. How do you feel? Thanks for taking the time with me today. Everything looks good. Appreciate your help.